Welcome to the Providers Report, where we delve into the world of value-based healthcare. Our mission is to empower healthcare providers with the knowledge and tools they need to deliver exceptional patient care. Each episode, we explore best practices, innovative strategies, and real-world examples of how to achieve the highest standards in patient communication and outcomes. Join us as we transform the future of healthcare, one conversation at a time.
Welcome to episode 30. Our guest, William Foshee, is a chiropractor who does a lot of work with diversity and inclusion and has such a big passion for it. He actually started off on Better Doctor Project back on episode 18, talking about the ins and outs of diversity and inclusion within healthcare as a whole. We talked a lot about why diversity and inclusion matters and what we as a nation can be doing better at the professional level. So don't forget to check that one out if you haven't already. Today's episode is going to be a little bit different. We're actually going to focus specifically on healthcare professional programs, so these universities and colleges, and we're going to chat about how we can make them more diverse. That way we can be training professionals to better serve our future patients and improve overall public health. Like usual, Dr. Foshee is dropping bombs in today's episode to really help get us thinking outside the box and get us thinking the right way when it comes to diversity in some of these programs. Hey guys, we are here with Dr. William Foshee, and we're going to talk tonight about diversity and inclusion in health professional schools. Where are we at as a nation? What still needs to happen? What kinds of things should we be looking out for? So first off, Dr. William, thank you so much for joining us.
Thank you. I'm glad to be here.
Thanks. So in your mind, where does the nation currently stand when it comes specifically to healthcare professional universities and schools with things like diversity and inclusion?
So, I think that, a lot of the schools, especially in the professional schools, like beyond like a bachelor's program in nursing, beyond those programs, there is this requirement for, physician's assistant students or podiatrist students to give a personal statement. And I think that, that there's this sort of recognition in giving our personal statements that we really identify the things about us which really magnify our unique perspective. So, the way that, we might be able to serve specific groups of people or where we might belong to an underrepresented group in a profession. So I really think that it kind of starts there. And I think that in those professions and schools that use this sort of holistic application process where they look at, exam scores and GPAs and, extracurricular activities, that those sorts of things kind of come into play as well. So I think that in general, the various professional programs or training programs are more cognizant of the fact that training a multicultural or broadly diverse medical workforce is paramount to improved public health. So where are we? I think we're still growing, but some folks do it better than others.
Yeah, it makes sense. And I know the first thing that jumps to my mind when you talk about that is some of the rural programs that some of the schools are creating for postgraduate work and even just starting practice for some of these healthcare professions. And, putting in our brains like, hey, there are these populations of people who don't really have the greatest access to healthcare, and if we can recruit people who care about these programs, they're more likely to go work in those areas. They're more likely to see patients of those populations. So I think a huge step would be to not only just create those programs, but to push them forward and make them attractive and try to encourage people to apply for these schools who care about those things. Obviously, incentives, have their purpose, but I think if you truly, try to recruit students who care about things like diversity and inclusion, even though technically we all should care. But if you, again, just try to recruit those students, you're naturally going to have this creation of healthcare providers who continue to care about those people, which is how we should want healthcare to be in the first place, if you really think about it.
We touched on it that it is important, obviously, for our future patients. It is important for healthcare as a whole, and that we should all care about it, like Dr. Beck just said. But can you really outline some real concrete reasons why diversity and inclusion is so important in healthcare professional schools?
Okay, so there are two things that come to mind. One is just I want to reflect for a moment about what I just heard in the conversation, which is these programs training providers for rural areas, right? So there are these sort of, geographic limitations and access to care. So, one of the things that, that sort of from a public health perspective or a social justice perspective, that this language of like these food deserts where folks are like 5 miles or more from a source of fresh food, right? That this impacts their ability to have healthy lives, right? So in the same sense, there are those areas of the country and cities and county, and those data exist, and they exist based on the parameters set by the federal government. They can tell you in this zip code at this intersection, it is medically underserved, right? So this is how those community health centers or federally qualified health centers or the FQHC lookalikes understand, like, hey, we can and should go do medical business in this neighborhood for the health of the community, right? So healthcare professions who acknowledge that, or professional schools that acknowledge that and engage in that, I think is a really important thing, not just for being active participants in the health of a community, but being really active in training a culturally competent workforce. So I'll give you an example. So many of the medical schools do rotations through all sorts of types of hospitals, and and so medical students get a tremendous amount of exposure. The University of Bridgeport, the College of Chiropractic in Bridgeport, Connecticut, they have a training system where they do clinical rotations through federally qualified health centers, and lots of their students have that opportunity. And they have this exposure to special populations that they might not get otherwise, right? Because if they were just to stay on campus in a university clinic. The other part of that kind of comes to mind is, you ask, why is this like fundamentally important, right? And fundamentally, this is important because the general makeup of the United States of America is changing. And so it's important that healthcare providers have the skills to navigate between, diverse groups of people, to manage, expectations on outcomes, to have culturally competent in-office practices, and ultimately really to, be the best possible provider that, the student can be on graduation.
Well, and getting that exposure as a student starts you off leaps and bounds ahead of somebody else. I mean, obviously anyone can pick this up and learn more about cultural competence at any point of practice, but I personally would rather be exposed to it as a student, to not, feel like you're more confident in those situations and that you've studied them or had those experiences way ahead of time. I know personally during my training, before my big internship, I actually had a 2-week rotation during one of my clinicals where we went to a community outreach center downtown Davenport, Iowa, where you're primarily seeing, the underinsured or people without insurance. And it's a completely different demographic than what I had been used to at the time. And even though it was a short 2 weeks, I know that experience single-handedly helped change my comfort level with certain conditions, with certain patients, with certain work environments. And I remember thinking to myself, why doesn't every single student get this opportunity? Because in my head, we should be able to be exposed to all different kinds of patients well before we graduate. And I know every school is different in how they do curriculums, but I thought that is one thing, especially that my graduate school really, really put at the forefront. I'm grateful for that.
For me, it was interesting because I felt like there definitely were tracks. If you were interested in focusing more with sports, you would, focus there. For our education, we had also clubs, right? So you could focus on different techniques and hone skills in certain patient populations that you were interested in. And I think that's really great. But as a student, I feel like there's such a buffet of opportunities to learn these things, which is wonderful, but sometimes it's also overwhelming. And so you might go into school with the idea that you're going to be a sports physician and leave loving pediatrics if you had the opportunity to check all of it out. But if you didn't and you kind of box yourself into a hole and you weren't forced to go through rotations, you may never know that or figure that out, or may never, you may not know what to do when the female athlete that you treat who loves you wants to bring in her whole family to you, which is where referrals come in and all that stuff. But I think that's why part of why we started Better Doctor Project is because we all have such different experiences, especially if you don't go through major hospital system or any other residency program. So for myself, I didn't have an internship at a hospital or any federally qualified health center. And I actually was working all the way through my doctorate program as well at a restaurant. And so we would get a lot of snowbirds down in Florida. And so I felt really comfortable with the elderly population and geriatric population because they came in droves to see me in clinic, and it was amazing. And I felt super confident with that, but I didn't feel confident with pediatrics. Love kids, also like handing them back, no problem with that. And so I didn't have that experience, and I wanted to make sure I got it before I left school, because if you're going to make a mistake, I would much rather make it with my clinician there and all the help possible, because they are going to walk through your door. So I actually chose a pediatric focused clinic because I felt like that was my weakest point and I wanted to learn more. And so that's great, but I could have also chosen just to hone skills I already had rather than build new ones. And I think they're both very valuable choices, but they're different paths, and it's hard to get all that exposure unless you're seeking it out.
Yeah,
That's the key, I think, is you both acknowledge that, right? And I agree with you, is that the opportunity exists oftentimes, but it is up to the professional student to take that choice, right? To really, get that exposure. And we don't all get the same exposure because we don't all have the same interest, of course.
So what do you think the answer is for some of these schools who maybe aren't where they should be in terms of diversity inclusion? Like, let's say, for example, there are some chiropractic schools that could definitely boost some of their minority matriculation rates. What are some ways that schools can help that? What are some ways for them to attract minorities as students? What are some events or programs that they can do as an institution to help make diversity and inclusion at the forefront? Have you seen any examples that have worked for some places?
So I had a first choice chiropractic program, and it was not the chiropractic program that I attended. So the reason that I went to my program was I went to school at Northwestern in Minneapolis, or in Bloomington. It's a Minneapolis suburb. And I had already made up my mind where I was going. I'd already started the application process. And I realized that Northwestern offered a diversity scholarship. So it was a substantial scholarship. And I thought for every incoming class in the chiropractic program, 2 scholars are chosen, and each person receives a 50% tuition reduction. 50%.
Wow.
So, and like that's substantial for a chiropractic college education. So they still offer the scholarship, right? So I interviewed for the scholarship. So the money part was like intriguing, right? But I was watching this. They used to have this really interactive video. It was like when VR was first kind of coming out, this virtual reality, and so I could, you could move the mouse, and it would like, give you the panoramic view of the lounge or whatever. And there was this person who I thought, oh, let me look her up. And I looked her up, and I realized that she was a member of the LGBT community. And so I felt like going to a college where they made an investment in every graduating class of 100,000 lost tuition dollars over the course of the entire program. That and they had some representation that mattered to me on their faculty, that it was an okay school to go to. Now, when I went to school there, I realized that the rest of the faculty was not so incredibly diverse, and so what I would look for. So I've been considering what matters for me for maybe an advanced degree. And as I've been looking into that, for a non-professional degree, but an actual master's degree or PhD, that is absolutely one of the things that I'm looking at. How diverse are the people that I'm learning from? Because I want to learn from people who are going to motivate me and challenge me to investigate further about my biases or my barriers to being the best type of doctor that I can be.
Absolutely. And I would think that, whichever school it is out there, whenever a school starts some of these programs, or maybe they start to have a scholarship, or they start to do this, and that in the world of diversity and inclusion, I would think some kind of a snowball effect would then take place, kind of like everything you've been doing with the American Chiropractic Association. When your committee first started and actually put diversity and inclusion on the map for the chiropractic profession, it was so brand new. And since then, I think you said, it's been 4 or 5 years since. So many other things have snowballed from that. So I feel like all it takes is the right person, whether it's a student, a faculty member, a professor, whomever. All it takes is really that one person to think, what this school needs? A little bit of a push in the right direction. And it might seem so small at that point, but I feel like so many other things could come from it. Again, it could start off with just one scholarship, but because of that scholarship, that recruits a student to come on board. Because of that student to come on board, maybe he has friends that come on board. Maybe because those students go to the school, they stay on as faculty who are now diverse. So I really think that's huge.
So I want to tell you, I did not win the scholarship. So I didn't win the scholarship, but there was and the two people who did get the scholarship in my class did not go on to do really remarkable diversity and inclusion work, right? And so if they hear this, I just want you to know that I feel like you owe me. No, I'm just kidding. But the folks who did win the scholarship didn't go on to do the same sort of things that I do, though they do their own types of things in their communities, right? And so after the fourth of 10 trimesters, they had a scholarship called the Diversity Leadership Scholarship. And so I am a diversity leadership scholar. And that's where I had the opportunity to demonstrate my skill in leadership around diversity and inclusion. And so I did get a 50% tuition reduction for the last 5 or 6 semesters in school, which is
amazing.
Still substantial amount of money, right?
Yeah, that's amazing. Do you think for our listeners who are no longer students and who are already practicing healthcare providers, is there something that they can do to help some of these institutions and schools? I know it's kind of tough when you're removed from a school, but is there any way we can contribute to the change from an educational level?
I think that the alumni associations that are associated with each university or each program tend to be really keen on meeting the kind of the needs of their alumni members. Chiropractic colleges are not, they don't have like such robust endowments as like some of the, like an Ivy League school or, a medical school that's been, training medical doctors for 150 years. And the earning capacity for a chiropractor versus a medical doctor is a little different. So even the capacity for that chiropractic doctor to give financially, so substantially is not really there. But as a student, you have the privilege to ask for an inclusive environment. You have the right to say, for my tuition dollars, I expect this quality of education from this quality of institution. Mm-hmm. And then as an alumni member, we have the right to say, I want to be able to give to the institution through service and financial support, but I'm not willing to do that for an organization or institution that doesn't support, more inclusive practices. So, there are some of the chiropractic colleges that are naturally much more diverse than others, just based on their location or their faculty or their, admissions team or whatever. But one of the things I learned a really important lesson from somebody at the American Chiropractic Association. So I'm going to go ahead and name drop him because I think he's so cool. So his name is Dr. Rodney Williams. He's a former president of the American Black Chiropractic Association. And I was asking him about, what do you think about this and membership that, and, financially, how does this work? And what do you think? And he said to me, people will put their money into the things that they find to be important. And that was such a game changer for me, like in terms of, where it is I'm willing to give my money, where it is I'm willing to ask people to give money to the causes I support, right? Is if it's important, we'll give money for it if we can, right?
Absolutely.
It's really about sharing your understanding. It's important with those who have the power to make change. And also me just, like Dr. Beck said, it just takes one person, but it takes one person who's also willing to make a little bit of a ruckus.
That's what leadership is, right? Leadership is being willing to exercise influence to, make some sort of change. And nobody gets to the top in leadership without, making some significant waves. And so if I'm going to make waves, I may as well make waves about something that benefits, lots of folks.
And it's easier to make waves with a lot of people too. You also, another important aspect of leadership is finding the right team and also listening to your team, which I think Dr. Beck and I have both had the privilege of working with you, Dr. Foshee, on several teams. And one of the things I think you do best is genuinely listen to your team members. And it creates an environment that is so powerful that, anything can be accomplished. I think that's a really important aspect of leadership too. And finding that those teams and those people within each school is paramount to progressing diversity and inclusion in these professional schools.
I'm definitely hopeful for the future. I think people are starting to have this on their consciousness more than ever. And I think we're getting more and more people in the right positions in leadership too, who actually want to make that difference. So thank you so much for joining us again, Dr. Foshee. You are incredible. Obviously, you know how Dr. Mack and I feel about you. We could have you on our show every single week and be in love and be in heaven. So again, thank you for chatting with us tonight about these important topics. We appreciate it.
Thanks so much for having me. Y'all take good care.
So my absolute favorite thing about Dr. Foshee is that he really gets your brain thinking in new ways that you just otherwise wouldn't. It's hard to explain, but he just opens up a part of your brain that just previously wasn't able to think in that way, and I love it. There's always somehow a new perspective he can just unlock while listening to him. So I really hope you felt that way too during today's episode. As always, don't forget to follow us on Instagram at Better Doctor Project and tune into this episode's show notes for more information. You guys are awesome. I will see you next time.
Thank you for tuning in to the Provider's Report. We hope you found today's episode valuable and inspiring. To stay updated with our latest episodes, subscribe to our podcast wherever you like to listen. For more resources and continuing education opportunities, visit our website. Together, we can make a difference in the lives of our patients and truly set a standard for value-based healthcare.